Okay, we'll start in one more minute. Welcome, everyone. Okay, I think we're ready to begin. Good afternoon, everyone. I am Daniel Rodriguez, Director of the Institute for Transportation Studies at UC Berkeley. It is wonderful to have you all here today for the presentation that Ted Mansfield is going to give. A couple of items before introducing Ted. As a reminder, we are celebrating our 75th anniversary, and we have a celebration planned for next Friday, next Saturday. Make sure you go to our website, its.berkeley.edu, to look at the lineup of activities. And if you're interested, please feel free to attend. We'd love to host you. Moving on to Ted. Ted, it's wonderful to see you here. Good late afternoon to you. Thank you for being here with us. Ted Mansfield earned his PhD from UNC Chapel Hill in environmental sciences and engineering. He is a transportation data scientist with RSG, interested in building custom software tools to estimate the health and equity impacts of transportation systems, integrating health considerations into prevailing transportation planning tools, and leveraging new data sources to better understand travel behavior. His research has explored how the built environment shapes transportation health impacts, including air pollution, physical activity, and safety impacts. He's a member of the Transportation Research Board's Transportation and Public Health Committee and the Urban Transportation Data and Information Systems Committee. Before joining RSG, Ted was a data science postdoctoral fellow in the Office of the Secretary at the U.S. Department of Transportation, where he played a key role in US DOT's Safety Data Initiative. When not thinking about new ways to bring health and transportation together, Ted enjoys riding his bike, sometimes with his dog in tow, and homebrewing kombucha. On a personal note, Ted and I met when he was a master's student in city and regional planning, after which he decided that environmental sciences was his calling. But as you can see, he didn't stray very far from transportation, so we're happy to have you here. A couple of quick housekeeping items. We have a live viewing session, so we have the owl set up in the library. I can see many of you there. If you would like to share your questions, you can do so by chat or wait until the end of the presentation and simply unmute. This presentation is part of the concentration of transportation and health, one of the initiatives of the Institute for this year. Ted, we are delighted to have you here. Take it away. The floor is yours.
Thank you, Daniel. I'm excited to be here and excited to see the initiative here and your leadership on bringing health and transportation together. Very happy to see this going on. So today I'm going to talk about incorporating health into the transportation planning toolkit, really from sort of a practitioner perspective. So first, I'll start with a little bit of context setting. I'm just sort of provide a framework for the presentation, go over some of the health and transportation connections broadly, and then I'll focus in on 3 case studies, which I'll go through relatively quickly, just given the time constraints, and then wrap up with a little bit of thought about what's next in the industry in this space. Make sure I can advance my slides. So health is influenced by many factors. A way that it is often understood is through the social determinants of health, which illustrated here. Health is a combination of education influences, the healthcare setting, the economic stability, and your social community context, and your neighborhood and built environment. And transportation really plays a key role in many of these determinants of health. So transportation systems provide access to employment and educational opportunities, as well as to healthcare and other important social services. They can also support affordable housing. On the other hand, transportation systems can impact the health of both their users through physical activity levels and fatal and injury crash risks, as well as the community more broadly through things like air pollution and noise. And taken together, these transportation health risks are pretty meaningful, and relative to a lot of the other big public health issues we talk about often in the United States. So we see here some recent estimates from the Global Burden of Disease report from the Institute of Health Metrics and Evaluation at the University of Washington, and we see here the air pollution and low physical activity risks, as well as the crash risks here, not called out, not in the chart, but called out in this box. And the combination of those three risk factors together, really sort of puts transportation on a playing field with many of these other important public health issues. But it's not always talked about sort of in that same context, and it doesn't always get the same amount of attention from a public health perspective. So what is a transportation practitioner to do? We build a lot of places that look a lot like this in the United States. And I think we can look at this and sort of intuitively say that this built environment might not support the sort of health outcomes we'd like to see, but what can we do about it? So again, coming from a practitioner perspective today, I'll be talking about how we can measure that and what the role of transportation practitioners is in this space. So the toolkit here to do this is in fact growing. It has really grown over the past decade substantially. There are a couple prevailing models here that are growing in popularity. The first being the Health Economic Assessment Tool from the World Health Organization, which is a relatively lightweight and easy to use tool, but it does require a lot of assumptions, which can sometimes be pretty complicated. There's also the Integrated Transport and Health Impact Modeling Tool, or IFIM. It comes out of the University of Oxford in the UK. This is a very feature-rich, complicated, very good model, but it can be difficult to implement. There is an open source version that's in development that hopefully will address some of the implementation issues that arise with this tool. But sometimes these pre-built tools fall short. They are at times difficult to integrate with existing transportation models, so the tools we already use to support decision making, and they may also have onerous data requirements. So returning back to the question of what can a transportation practitioner do, I'm going to talk about three themes here. The first being meet the models where they are, the second being repurpose high quality tools, and the third being build something new. And I'm going to do that through the use of three case studies. The first case study will be in the vein of the first theme, which is meet the models where they are. And I'll talk about an application of a health impact model in the Raleigh, North Carolina region that integrated a model with the existing travel demand model in the region. The second case study will highlight the repurpose high quality tools theme, and I'll talk about that through the lens of a study in the Twin Cities region that used evidence from a high quality smartphone based household travel survey to explore built environment influences on active travel. And finally, I'll talk about the build something new theme, and I'll highlight a fun recent project, which is the development of a bicycle travel demand model for the Salt Lake City, Utah region. So starting off here in the first case study, some context on the study. This was part of the Commuter corridors study in Raleigh, North Carolina, which was conducted by the MPO there to assess several land use transportation scenarios. There was interest in comparing these scenarios using both traditional and emerging performance measures. One of those emerging performance measures being health impacts. And so the approach here was to integrate a simple health model with the travel demand model. The logic here being that the travel demand model was being used to produce a variety of other metrics, things like travel time savings that we see often in the transportation decision-making paradigm. So this was an attempt to sort of get health into the conversation through this model. So a little bit about the triangle regional model. It's a traditional 4-step travel demand model. What we see on the right here is the mode choice submodel here. So when the model is predicting what mode you're using. And I'd like to highlight here that the model does predict non-motorized trips as well as walk trips to and from public transit. So there are some outcomes, some outputs from this model that are useful in the public health context. I kind of close by saying the model is imperfect, but again, we can use this to get health considerations on the table. So a little bit more about the scenarios considered here. I'll talk about four of these development scenarios. The first being a aggressive highway expansion scenario, in which case, or in which the freeway capacity in the region was doubled. The next being a congestion pricing scenario, which involved the introduction of tolls as well as a downtown cordon charge. The third, an equitable transit-oriented development scenario, which involved more frequent transit with growth concentrated near existing routes. And the final being a smart mobility hub scenario, which entailed the creation of new transit routes as well as land use development clustered near those smart mobility hubs. And so to do this integration here, I want to review the building blocks here of a health impact model. In the most basic sense, you kind of need four things to build one of these models. The first is a population. That population has a baseline health status, as well as health behaviors and exposures. The second thing is transportation health pathways. Commonly, these can be physical activity, air pollution exposure, and crashes. And these need to be linked to a health outcome via epidemiological evidence. The third element here is a estimate of a change in exposure. So this can be user specified, in which you could sort of assert that 5% of trips will be made via biking. They can be derived from the literature. So this is thinking about elasticities, the Ewing and Cervero view of the world with the X% change in one built environment attribute leads to Y% change in walking and biking. Or we can use another model to estimate these changes in exposure, like a travel model. The final component here is a method for translating these changes in exposure to health impacts. There's a couple of modeling decisions that need to be made here, which I won't belabor here in the interest of time. So in this application here, the population we used was the same population that is under the hood of the triangle regional model. The transportation health pathway we considered was transportation physical activity. We used the travel demand model to estimate changes in exposure. Again, the walking and the non-motorized and walking shares from the model. And finally, we used the population attributable fraction method to translate these changes in exposure to health impacts. And here is this model. It's kind of a scary looking equation, but it's actually relatively straightforward. And this equation essentially says that the change in exposure for one of these health pathways for an individual I impacts the relative risks, which come from epidemiological literature, and that can be from those you can estimate a attributable fraction or avoided mortality in this case from that change in exposure. So some results here. The first four pictures here show the change in walking for transportation for each of these scenarios coming from the travel model. In the top left, we see the highway expansion scenario. So I think kind of as expected, we see a general reduction in predicted walking across most of the region. The top right is the congestion charging scenario, which was interesting to me in that the model is predicting these higher travel costs for motorized modes. So it shifts some of the demand over to non-motorized and public transit modes. And we see that reflected in a slightly higher increase in walking across a relatively large portion of the study region. The bottom left shows the results for the equitable transit-oriented development scenario. We see substantial increases in walking sort of along the existing transit corridors in the region, and some isolated reductions in walking, which is sort of the model pulling some of those trips away from some of those exterior locations, those further afar places. And then finally, the smart mobility hub scenario, we see this interesting pattern where each of the new mobility hubs has higher walking sort of at the detriment of some of the other areas of the region where this might have been land use development that did not occur there and instead occurred in the smart mobility hub location. So the final component here, again, is translating these changes in the exposure to changes in all-cause mortality through that attributable fraction approach. And we see similar sort of patterns here across the 4 scenarios. So a general negative health impact in the highway expansion scenario, a widespread and marginally beneficial impact in the congestion charging scenario, a sort of targeted health benefits in the equitable transit-oriented development scenario, and the mixed pattern again in the smart mobility hub scenario. And we can look at these sort of by subpopulation. These are the subpopulations that are given for the model. So this is sort of the same exercise of this is what the model does. At least we can predict health or estimate health outcomes for the same population group. So there's some ability to look at disadvantaged populations through an approach like this. So I know I kind of flew through that, but that is because I have 2 more of these to highlight. So I think I wanted to close this with a few lessons learned from this approach, which is that some of these prevailing tools, they're imperfect, but they might still be able to support some of these health impact modeling efforts. So again, not the gold standard, but they're probably better than nothing. And the end result of this little graphic here on the right was used in public outreach materials and was distributed to sort of the public. And we see that that sort of last bullet over there includes some of these health benefits. So we were able to communicate the benefits of some of these scenarios from a health perspective during the decision-making process. And so I'll close this this case study with the idea that sometimes we have to sort of meet the models where they are, and that can still be a useful exercise. So the next case study I'm going to cover here is an exploration of active travel behaviors in the Twin Cities region, Minneapolis-St. Paul, using a smartphone-based household travel survey. So a little context about the survey. The Twin Cities region has a really great program called the Travel Behavior Inventory, which is a recurrent travel survey program. We're currently in the middle of the 3rd wave of this program. So there's a 2018 to 2019 survey wave, a 2020 to 21 survey wave, and the current wave in the field, which is 2022 and 2023. These surveys have been administered via a smartphone-based survey app that provides high-quality GPS traces called RMove. And the survey also employed multiple strategies to help improve the representativeness of the sample, including partnerships with community-based organizations, differential incentives, and some non-probability-based sampling methods. So a couple of advantages from these smartphone-based travel surveys in this context. So these surveys provided high-quality GPS data for all smartphone participants. They're generally collected at a resolution of around 30 seconds per location record. And because this is a sort of app that we as RSG own the app, we can control the data generation process. So versus something like a passively collected data source where you're not entirely sure what the frequency is, we're getting a very consistent trace record for survey participants. And this helps the reporting of short distance, short duration trips, which may be more likely to be walking and biking trips, because the survey or the app will prompt respondents once it's determined that someone has taken a trip, and you'll be able to sort of answer if you're walking or biking at that instance instead of having to recall at the end of the day in a more traditional diary travel survey. These surveys also use longer data collection periods. So this was a 7-day survey, so especially important for some active travel behaviors where you might not engage in walking or biking every day, but might a couple days a week. This helps capture those travel behaviors. So the question here then was, can GPS data from these surveys be repurposed here to support health questions? So what we did here was we first calculated walk and bike trip durations and combined them to get a single measure of transportation physical activity, which is accomplished through the use of metabolic equivalence, which is a way to sort of normalize the intensity of walking and cycling activity into a single measure. And then we classified every survey respondent as to whether or not they met the CDC physical activity guidelines during their travel week, which is 150 minutes of moderate physical activity per week. The next thing we did here was we wanted to look at the built environment influences on these physical activity behaviors. So we used the H3 spatial indexing system to generate built environment measures at a within hexagonal grids across the region. And we call this a grid and buffer approach. So the way we did this was that we calculated built environment measures, so population density, land use, diversity, physical design, those the 5D variables within each of these smaller grid cells. And then we aggregated across the nearest end cells within a half-mile buffer of each cell to get this sort of buffered idea. So we have gridded and then we buffered each grid cell to get a sort of map of these built environment measures across the region. And this approach helps avoid some common pitfalls of using polygon geometries for something like this. It avoids the modifiable area unit problem in that each of the grid cells across the entire study region have the same size. And hexagons also have a nice attribute in that the corners are less prone to measurement error than, say, a square grid cell. So they're a little bit more uniform in terms of the spatial measurement error within a hexagonal cell. And the final reason for this is that buffer methods can have some computational issues at scale. So I'll get into this in a second in the regression modeling here, but we calculated these built environment measures for the home locations, which only had about 13,000 of those. So that's not a huge computational lift. We also calculated them at all the dwell locations we had, which is getting close to 400,000 locations. And finally, we used each unique trace GPS trace location within the data set, which is around 8.6 million locations. So at that point, we're starting to need an approach that's a little bit more computationally efficient than something like a buffer method. And here's an example of what these measures look like across the region. Here I'm showing just 3 of them. I think we used 6 or 7 in the paper. So an intersection density measure, a land use diversity measure, and then a bike facility density measure. So we kind of see how this grid and buffer approach produces these nice distributions of these built environment measures continuously across the study region. So the final step here was to join those built environment measures to our survey data. And as I alluded to earlier, we used 3 approaches here. The first was to use just the home location. So characterize the built environment for an individual using just their home H3 cell essentially, and its buffer area. The next was to look at all the dwell locations for a single respondent, and then take a time-weighted average of the built environment around each of those locations. So this is trying to get at the idea of what if you live in a walkable home environment, but you work somewhere that's not as walkable? How does that impact your travel behaviors? And the final was to take every GPS record in the data set, and then the same approach here, where we have a time-weighted average of those built environment characteristics using the GPS trace locations. These were then summarized for each individual, and then a series of regression models were estimated with the probability of that individual eye meeting the CDC physical activity recommendations as the outcome variable, built environment and socioeconomic variables as explanatory variables. So the results here were really interesting to me, that the 3 regression models, they do differ. And if we use the AIC as sort of a rough model performance comparison, we see that the models do sort of improve as we move from the home location model to the trace location model. And the thing that really stuck out to me, I thought was super interesting, is that some of these design variables, especially the bike facility and major roadways, which might be sort of barriers to walking and biking, they are generally not significant in the home location and dwell location models, but in the trace location models, we're getting a full sort of accounting of the device's activity space. We see those built environment characteristics become important in that sense, which was an interesting finding, which I'm still sort of digesting. This is a recent paper, so I'm still trying to think about what that might mean, but very interesting nonetheless. So some lessons learned from this case study. To me, we produce a lot of really great data in the transportation world, and we have some wonderful tools. And those tools can be repurposed to answer health questions in a useful way. So sometimes we just really need to repurpose our existing tools and sort of to answer some of these important health questions. All right. So I'm going to cover this last case study here, which is, this is a fun one because I got to build something new. Not that saying the other ones weren't as fun, but this one's exceptionally fun. So this is the development of a bicycle travel demand model for the Salt Lake City, Utah region. So this began with a sort of workshop with the local government entities here in the Salt Lake City region. And they sort of knew that they wanted to do something about bicycle infrastructure investments in their region. And they recognize that traditional travel models don't do a great job at estimating bike trips. They might be focused on auto modes. These models might be calibrated using local traffic count data. And importantly, they're often not sensitive to infrastructure changes that may impact the ease of cycling. So the introduction of a bike lane or new bike facilities just might be out of the scope of a lot of these travel demand models that are sort of in practice. So this stakeholder workshop was really, the idea of this was to develop requirements for this model and ensure that we were meeting the needs that the client saw in their region. So the solution we landed on here was developing an open source bike travel demand model. This model is a behavioral trip-based model with 3 submodels. There's a trip generation model, which estimates how many bike trips are being produced and where are those trips being produced. A trip distribution model, which estimates where those trips are attracted to. So this is sort of the destination piece of the equation here. And then finally, a network assignment model, which helps us understand what routes are used and at what volumes those routes are used. And this model core was implemented entirely in Python here. And we used a configuration-based sort of software architecture here, which allows us to flexibly specify these model components, which is an important characteristic that I'll sort of highlight in the subsequent slides. There was some pre-processing using the ArcGIS, ArcPy stack and some Jupyter notebooks that have been adopted for post-processing the model results. So talking specifically about the model here in the Utah region, the region has over 19,000 microzones, so pretty small travel zones in the region. It includes some special canyon zones, which were used to model recreational trips into the mountains east of downtown Salt Lake, which are pretty interesting, and we'll see what they look like in a second. And each of these zones have demographic and built environment characteristics associated with them. The model has around 140,000 network links. And the trip generation and distribution model coefficients were estimated using a household travel survey from Sacramento, California. This was, again, another RMove survey where RSG had sought to oversample cyclists, which gave us a sample size of about 5,000 bike trips from over 4,000 households. So we used the model coefficients from that survey in Sacramento and applied them here in the region, and we'll talk about that in a second. So I'm going to talk through briefly each of these model components. This will be pretty brief because I'm getting a little short on time. So first, the trip generation model. Trips are generated at a microzone level for each household, for households at the microzone level across 8 trip purposes. 3 recreational purposes, work purpose, 2 school purposes, and then maintenance and discretionary trips. And again, highlighting this flexible model specification, this is actually one of the configuration files that can be used with this model. So we can, modify these coefficients, modify which variables are used. Again, these were derived from that Sacramento survey, but because of this configuration-based design, it's pretty, it's designed to be easy to test out other coefficients and calibrate the model to local conditions. The trip generation model here under the hood, it's a pretty simple linear regression model, which estimates trip generation as a function of, again, built environment and sociodemographic characteristics. The second model here is a trip distribution model. The foundational step here is to pre-process that travel network that we mentioned earlier to generate generalized bike travel costs. So we adopted an approach that was first developed at Portland State University, adapted here in Salt Lake locally by the Wasatch Front Regional Council. It's also used by the Los Angeles DOT. And this method includes penalties for things like turns, high traffic, slope, things that make cycling either harder or perceived to be more difficult. And it also reduces impedance given supporting infrastructure like bike boulevards and bike paths. And so again, we sort of see how this is specified in the model. Sound a little bit like a broken record, but again, this is designed so that we can modify these coefficients as we localize this model or as we learn and get better information about how these impact bicycle behaviors. Oh, I left out a very important component of this, which is that these generalized costs are then used to create what's called a skim. So a skim takes every zone in the model, so the 19,000 zones, and calculates the cost along the network using this generalized travel cost function to every other zone in the network, but using these generalized costs. So penalizing, again, for things like having to turn left against traffic and those types of attributes. And that's important because for trip distribution here, a destination choice model is used, which essentially, matches it. There's a logit model here that is based on the size of the attraction at each zone, as well as the generalized cost on the network to reach that zone from every other zone. And there's a utility maximization procedure here that matches productions and attractions within the model. And again, we have this flexible specification, so we can modify these coefficients as we gain more knowledge. The final piece here is assigning these trips to the model network, again, using these generalized bike travel costs. The only catch here is at this time, instead of just storing the costs, which is what we did with the skims, because they're small, we store the entire route when we do network assignment, which is a little bit more computational effort and takes some compute resources. But that allows us to look at results. It allows us to aggregate trips to network links and all those types of things. So I'll cover a couple results from this application. The first here is just a map of trip origins from the model in downtown Salt Lake. So it's a little hard to see, but these yellow sort of squares here, this is downtown Salt Lake City. To the east here, this is the University of Utah. So we see a pretty high concentration of trips from those regions. It's also useful to think of these, by purpose. So if we look at just the work purpose, we see an even higher concentration of trips in sort of the downtown region relative to the rest of the region. But then we can also look at our recreational trips, and this is these funny looking zones here. These are those canyon zones I alluded to earlier. So here we can see how the model predicting trips to and from those canyon zones for the recreational purpose, but not for the work purpose, which is what we'd want to see. So some ongoing work now. This project's actually is what I was working on today. So it's very much off the presses. We're currently working on what we're calling a light calibration of the model using available streetlight data in the region. So the the regional council there has access to streetlight bike OD data. So we're using those data to adjust some of these model coefficients that we saw earlier because they're estimated using the travel survey in Sacramento. We know that's not perfect. We also know the streetlight data aren't perfect, but we feel like combining those two data sets will give us a better model than either one in isolation. But a quick look here, this is the zonal trip origins from the model, and then the streetlight data actually shows for a pre-calibration, a fit that is not awful considering coefficients from another region and all those sorts of things. So we feel pretty good about this as sort of a pre-calibration output from this bike model. But I think maybe more exciting is that RSG is conducting the Utah statewide household travel survey, which is going into the field very soon. This survey will use the RMove app. So will give us an opportunity to re-estimate the model coefficients using local survey data. And we're sort of doing the streetlight calibration as an interim step, and then looking forward to getting some real local data to sort of revisit the model once the survey is complete. So some lessons learned from this last case study is that this is sort of a consulty thing, but sort of trust your clients. Transportation agencies really know what they need a lot of times, and they recognize when their tools don't support those decisions. And so if that's the case, don't be afraid to build something new and help solve those problems. So just a quick review here. The question that sort of framed all of this is, what's a transportation practitioner to do? And I highlighted these 3 case studies and have these, sort of 3 approaches or themes that we can use to help push the industry forward. Sometimes we need to meet the models, where they are. Sometimes we have an opportunity to repurpose high quality tools. And then if we're lucky, we can find somebody who wants to help us build something new. And that's always fun and exciting work. But I'll close this. I couldn't talk about models so much without emphasizing that we need to recognize the limitations of our models. So I feel like I saw this slide from Daniel many times when back in the day, which is all models are wrong, but some are useful. So I think some things for the transportation professional to think about is how well do our models really estimate active travel? They do produce a walking and biking measure. How reliable are those measures? I think there's a larger question of how much we really trust our models, especially now with how much travel behavior has changed over the last couple of years. And so I think there's a lot of reason to think hard about the results we're getting from these models. And critically, do our models address equity? And if they do, how well do they do that? The flip side is there's also things for the burgeoning health impact modeler to consider, which is how reliable are behavioral predictions that are taken largely from sort of cross-sectional evidence. So we know there's things like self-selection bias that may impact how individuals respond to both environment factors. And we have to consider those and think about those when we're building health impact models. In a similar vein, what about sort of compensatory behaviors? So an example here, maybe from the bike model, if we build some new infrastructure and I start going on recreational bike rides or biking to work, is there some likelihood that that might displace physical activity elsewhere? And if so, is it important to account for that in the model? And then finally, same question here is do these models address equity? And if not, how can they? So my last couple of slides here are a little bit of a call to action of cheerleading the health, the sort of importance of health in the transportation world. So I think there's a lot we can do now. I think we can embed health questions into household travel surveys. So things like asking about health status in household travel surveys is a pretty low, low effort, high impact activity, I think. And it's also relatively easy to leverage these high quality GPS data sets to learn more about how we respond to the built environment. I also think it's relatively straightforward to incorporate health into travel demand models. The health impact modeling tools they're there, and we can build them to use disaggregate model estimates, which is highly valuable. think this is especially true for activity-based models, which model travel in a slightly different way than the 4-step models we talked about in this presentation. And finally, we can incorporate health into other transportation planning tools. So we might consider building specialty models like the bike travel demand model, or including health considerations into larger models like strategic planning tools, such as vision eval. So a couple of resources of what we can all do and what you can do as sort of young professionals in this space. TRB has a health and transportation committee. Oh, this slide is old. It was not formed this year. It was formed a couple of years ago, but the hooray still applies. We're always looking for volunteers on that committee. Lots of work to do. ITE has a transportation and health standing committee, and they're developing a transportation and health clearinghouse, which is exciting to see ITE so active in this space. There's a online resource here called the Travel Forecasting resource, which has a page, a wiki page on health and transportation data sources, which I helped develop the first version of that page. I'd be happy to have other people edit it and contribute their knowledge as well. And there's also a lot of interest from public health organizations, sort of reaching across the professional aisle. So American Public Health Association and Institute of Medicine are both very interested in built environment and transportation topics. So that is all I have today, and I finished with exactly 10 minutes to spare for questions, which I'm pretty excited about.
Ted, thank you. Thank you very much. Right on time, and thank you for a stimulating presentation. I welcome questions from the audience using the chat, or if you want to just unmute or raise your hand and then unmute, or any of the above, that would be great. But I want to start with one question, Ted. These models, as you showed us, could be pretty complex and with a lot of assumptions behind them. And so in your experience working with clients and decision makers, I wondered sort of how do you manage the communication of both the model results and then the uncertainty that's embedded in them, and what seems to work better, what seems to be a challenge, and what is most difficult in that communication with clients?
Yeah, that's a very good question. So there's I think I have sort of two perspectives here. One of them is a more pragmatic perspective that maybe I'll start there, which is that there's lots of uncertainty in other measures that are used for transportation planning all the time. And there's a lot of uncertainty in travel time predictions and these congestion reduction measures and really the sort of foundational elements of transportation planning. So part of me thinks that just getting health on the table and in the sort of conversation is a critical piece, even though there is uncertainty in all of these things. So that's sort of my pragmatic answer. My academic answer, I'm thinking back to how I would answer this a couple of years ago before getting sucked into the consulting world, is that there are tools we can use. So we can use like Monte Carlo methods and those types of things to help understand where those uncertainties lie in these models. And the communication of that is always a challenge. But I do think it's, from a sort of generating new knowledge perspective, I do think it's very important to sort of consider that. But I would again caution if we do that to also think about the uncertainty in other model parameters. So the health outcomes might be uncertain, but again, so are those travel time estimates. And I'd love to see the same approach applied to both measures.
Thank you, Ted. I got another question here from direct message. So you make a good case in expanding the purview of transportation to include health. How receptive are decision makers of expanding outcomes to include health considerations?
So I think in my experience, it's varied substantially currently. I mean, there's sort of like, I think there's kind of like the most innovative, MPOs in the country, I think are sort of ready to have this conversation. I think it might be that they're hearing about it from, constituencies, or might even be getting political pressure to think about, especially things like safety and equity concerns. That's not universally true across the country, of course. but I do think there have been some recent federal policy changes that might help sort of turn that tide and generate some interest at the local level. Earlier this year, the Office of the Secretary released new guidance for benefit cost analysis for transportation projects, which is used as a decision criteria for all the competitive grant programs that go through the Secretary's office. And for the first time, health impacts were listed in that guidance, and DOT provided explicit guidance about how to do that, which sort of opens the door for MPOs that are competing for these federal funds to think about it and provide some incentive to do that. The FTA, I think, has also provided at least some indication that thinking about this as well. So they had a notice for comment early. It might have been the end of last year, maybe earlier this year again, around methods to estimate the health impacts of transit projects, which sort of signals that they might be thinking about making policy in that space as well. So I think we're starting to see some federal forcing in this environment, which would, I think, help bring along some of those other MPOs that might not. And I won't talk about state DOTs necessarily. I think they'll be the last to the table in this conversation. But I am very excited to see professional organizations like ITE embrace this as well. I think it's it might be indicative of sort of a little bit of a sea change in the industry, which is welcome.
Okay, I have one last question. This is from my side. So you straddle these various fields, Ted. If I were an engineer, a student or a practitioner or a planner, I'm in graduate school, how would you recommend that I reach out to the health world, generally speaking? If I'm interested in health impacts, I just don't know where to even start. And how do I kind of start to embrace understanding those health impacts that you outlined, that you include in your work, so that I can begin to incorporate it into my own practice and work? What would be some promising strategies to go about that, building of bridges across disciplines?
Yeah, that is a great question. I might need to think about it for a second. I might reflect on my own journey here a little bit, which was, I think I really came into this just by knowing, meeting some folks who are really sort of doing this work. I always think of Leslie Meehan when she was in Nashville as just someone who I talked to her, got inspired by what she was doing, and I was lucky to be at a place like UNC that had such a great school of public health that allowed me to explore some of that coursework as a graduate student. But it is, it can be a little difficult finding the sort of entryway into the discipline. Now, I would say, take advantage of the new TRB committee. The people that are in this space are super engaged in it. I would welcome any conversation with anybody who heard this today and thought, oh, I want to talk more about that. Happy to have a conversation there. Refer you to other folks who know, there's a lot of passion here. So I think it's almost, I would encourage you to try to find someone who's passionate about this and let them guide you a little bit, because it is formative. So it's hard to find a place to really latch onto. And I kind of empathize with that, having gone through a little bit of that myself a couple of years ago.
There is one question in the chat. Are there any clear equity outcomes from the health impacts of transportation research?
So there's a lot of understanding, that like there are a range of current inequities in the built environment and how that influences, health outcomes on the ground. Now, I do think there's room for the field to get better about understanding the interventions that might help address some of those sort of systemic inequalities that exist. I'll put my modeling hat on and say that we can use these disaggregate models. So thinking back to a activity-based travel demand model where the individuals in that model have a suite of demographic characteristics. We can estimate models that stay at that level and let us think about impacts to address inequities that currently exist. But it's only as good as the research that that understands how folks might respond to intervention. So I guess I would say there might be a bit of a gap there in just understanding the behavioral side of this equation and really understanding of effective interventions. But the modeling tools, I think, are there to do that really important work.
Okay, Ted, thank you so much. We're going to be right on time. We're 1 minute shy of being on the top of the hour. Thank you, Ted, so much for a great presentation, for bringing this topic to bear and to being able to bridge both across disciplines and also across researchers and practitioners. As always, if any of you in the audience are interested in job opportunities, I'm sure that Ted would love to see your CV. His email is right on the screen. Follow up with Ted if you are interested in the topic or in following some of the recommendations he gave about getting involved with various committees and organizations. Ted, thank you. Everyone join me in providing a virtual applause.
Thank you, Daniel. Thank you all. A pleasure to share this work with you today.
Great. Thank you so much. Until next time.